today, To Your Health is once again at the Illinois Neuro and Physical Rehabilitation Facility on Addison Road in Elizabeth in Wooddale. And today we're not going to talk about anything specific, but we're going to talk about a lot of things. We'll talk to different staff. We're going to talk about a laughing yoga, which sounds like a lot of fun. I don't know, I can laugh at myself when I'm doing yoga, but this is a yoga that's geared to laughter. We're going to talk about concussions and how the doctors here at the facility are treating patients with concussions and brain injuries. So let's get started. First, we're going to talk with Kristen with regards to the laughter and yoga. Laugh for the health of it. I just love the title of that session. We're here with Kristen DeDominic, who runs a laughter yoga class right here at the Illinois Neuro and Rehabilitation Center. What do you do, and is it difficult? Is it for any ages? Give us a little information on this.
Okay, so basically what laughter yoga is, and sometimes people call it laughter club. It's just a time where people get together, and it's a type of yoga. So, people go to, kind of what you think of as a yoga class. This is a yoga combined with laughing exercises. So the physical benefit is it oxygenates the brain and the mind and the body, and it gets you flowing. So it's a good cardio workout.
Well, I've heard that laughter actually does help you. It helps you to a better health, actually.
Yes, to a better health. Yeah,
it releases something in the body, endorphins or whatever. It makes you heal better, actually.
You're right. So there's a lot of studies that have been proven that when you do this on a consistent basis, or even once or twice, it kind of gives you a new outlook on your life, a perspective. So physically, it's very beneficial. It kind of aids in, when people are sick, they can feel better. So people that are sick or healthy, it's just a wellness situation. Also, it's a mood lifter, and it kind of brings you out of your box, so it gives you a new perspective, because what you're trying to do is initiate that inner playfulness that we all kind of forget we have. And by doing it in a group and all kind of feeling maybe hesitant in the beginning, then it just becomes very joyful. And the best thing is that when you go to it and you're like, it's not jokes, it's not comedy. Is it fake laughter? But fake laughter actually has the same benefits as real laughter. But when you're in a group and you're being silly kind of, then it's contagious. So then it usually ends up genuine laughter.
So you can start with the fake, so you start with, it's not called fake, it's faux. It's faux laughter.
Faux laughter, yes.
Faux laughter.
But it's different things with clapping and, moving around. And if you're not able to move around, people do it sitting down.
Okay, there's the chair yoga.
Yes, and you can be in any age, any condition, and we'll work with it, because everyone can laugh. I don't have to teach people how to laugh, but I just give them some tools. And it's a very joyful experience. And I've done it with businessmen and businesswomen who are like, this seems kind of different. And then they usually say it's the best part of their day or the best thing they've ever done for themselves.
It releases the stress, I can imagine.
Mm-hmm, and lets them kind of just do something different in a little bit of, in a different way. And it's about 30 to 40 minutes, so it's not real time intensive, and you can go consistently if there was a club, or sometimes we just do it a one-time shot. And at Illinois Neuro and Physical Rehabilitation, we're going to kind of start it off and do it 2 times in April.
So you're going to start it off with 2 times in April, and the dates in April are Wednesday, April 9th from 7 until 8 p.m., and Wednesday, April 23rd, again from 7 until 8 p.m. And my goodness, it's only $5 a person?
Yeah, just $5 a person, and just come and with an open mind. And if you feel jittery, I guarantee you'll come out feeling good. It's nothing stressful.
Are there mirrors in the room?
No mirrors.
Oh, thank goodness.
No tapes.
No tapes.
And I'm the only one that can talk after we start laughing. So, I kind of give them a little background, so that they understand what we're doing, where this all came from. But I will guide you the whole way. But even like the initial greeting will be a laughter greeting.
No kidding. I mean, this sounds like it's a lot of fun.
It is a lot of
and I
fun.
love what you call it, laugh for the health of it.
Yes, that was my little keyword my brother and I came up with.
I
Laugh
like
for the
that.
health of it.
I really like that. I like that a lot. Now, do you only work out of this facility? Do you have a private a practice or whatever?
I don't have a private practice. I feel like facilities such as, Illinois Neuro and physical rehab is a great place because it's kind of fits with kind of more of a holistic approach to healing, especially with their new functional neurology, and things like that. But I go to, different schools. I've done it for senior settings and nursing homes, senior clubs. But I can kind of set it up anywhere, one time or consistent basis.
I can see a laugh party.
Yes,
I
they
can
have
see a
done.
home laugh party. That
Yes,
would be fun.
and there has been those, and my email is on there. So if anyone has any questions, I have a designated email.
What is your email?
Because it's so new. It's laughterclub@icloud.com.
It just sounds like it would be a lot of fun, even in the workplace. If a group wanted to get together at lunchtime and just do a laugh yoga.
You're right. There's corporate benefits to get. It's kind of a team building exercise. People get more creative. People get less stress. You work with children. Not only is it fun, but it puts kids on a level playing field. There's studies that it decreases bullying. You do it with seniors, it takes away pain, it takes away loneliness, it takes away that feeling of isolation. And like with seniors, you might do a little more touching, more hugging. And with teenagers, there's less touching, but everyone's together. And if you all feel a little hesitant, it kind of makes everybody part of the same group, right? It takes away like the different...
Takes the wallflower away. Mm-hmm. Takes the wallflower away.
So there's different benefits.
Well, this really sounds like it would be a lot of fun. And really, I think it would be a great place to try on April 9th and April 23rd. Both of them are Wednesdays here at the Illinois Neuro and Rehabilitation facility.
Yes, and I'm hoping we get a good group, then we continue it and be working with Dr. George Michaelopoulos on that. So
that would be terrific. Thank you.
Thank you so much.
Thank you. Now, before Kristen brought her laugh yoga to this facility, you were a patient because you had migraines?
Yes, I've had chronic migraines. I had chronic migraines for over 20 plus years, and I'm probably similar to many, many people. Been to neurologists, just primary physicians and medicine injections. And since high school all the way till I had young children. And Dr. George, I've known for many years. I think my mom was like his 300th client or something. So we've known him for a long time. And he said, Kristen, I think we've got it now. And I said, very hesitantly, I said, okay.
Well, one of the treatments that they use is the Metronome, which you're going to demonstrate it for. So
Yes.
I can. I have actually tried this once before, and I was diagnosed as hyper, which doesn't surprise anyone. But you're going to show us how it works while I talk to Dr. Ivarone to explain just what's happening. Okay?
Yeah, I think it's great.
Okay, now, Dr. Ivarone, we have Kristen here demonstrating something that she's used or you've used to treat her with migraines. You also tell me this is used for concussion patients also?
Yes, this device is called interactive metronome. What we're doing is we're synchronizing her brain timing, and it measures her beats in milliseconds, which are thousandths of a second, and it shows where she should be in relation to her age. And what we're trying to do is connect the disconnection between the right and left hemispheres. Now, we use it for concussions. We use it for traumatic brain injury. We also use it for people who have attention problems or sensory processing issues.
And how do you, what do you do with the information that you gather from this?
What we do is we assess where they need to be, and I set a protocol for them to get them into superior brain timing. And for the brain to change, we need about 30,000 repetitions. This is where the neuroplasticity of the brain comes in, which remains permanent after that unless they get another head injury. But even if she's in superior brain timing, you need X amount of repetitions before it becomes a permanency.
Okay. So this she will do for 8 minutes, and she'll do it a number of times, and then you evaluate her?
Yes. Usually at her age, we'll set a protocol for about 1,000 reps at a time. So that'll be about 18 minutes worth of training.
Okay.
Yeah.
All right. And you use the same method for either brain injury or migraines because both have to do with the brain.
Right, and what we're doing is she's doing both hands right now. When we set a protocol, depends on what side of the brain we need to do. Where the right brain controls the left side and the left brain controls the right side, we might have her just doing one side of the body to engage the opposite brain. We also will incorporate feet and hand activity or heels, so it's not just both hands.
Okay.
We incorporate a lot of different body parts depending on what the problem is and what part of the brain we have to stimulate.
Okay. Let's go on to the next treatment.
Okay.
Okay.
Just calibrate. So right now you're going to follow the red lights, and this is going to check for a thing called spontaneous nystagmus.
Oh,
Okay.
no.
So I'm just checking. So we're not going to induce this. So here we go. So just follow. Just keep looking straight ahead.
Well, there's two of them.
Yeah, that's okay. Keep looking at both, and then they're going to go away. And this machine here will tell us exactly if the patient has spontaneous nystagmus. Now the lights are going to go off. Just keep staring ahead. And this is recording her eye movements, and will give us a protocol for us to do very specific exercises with this patient. Okay, so here is the next test. So this one here is called horizontal gaze. Okay, so you're just going to follow the red box, okay, and just keep staring at it. And what we're looking for here is for any unnecessary movement in the eyes, and this looks pretty good actually and it's going to go to the other side. This is leftward gaze fixation, and it's going to go to the right now, and now we're looking at rightward gaze fixation, which is really good. You're solid as a rock here. That's awesome. Now the next one's going to be vertical gaze, so we're going to go up and down. Okay, so exact same thing. He's just going to go up, and this is going to measure horizontal gaze in the upward position and in the downward position. It's actually going to also measure her pupil diameters too. Here we go. So this is down, so just keep staring there. And the pupil diameters in here give us an indication of how well her sympathetic and parasympathetic nervous system is firing. Now the next one here, Arlene, is just going to follow the box to the right and to the left, okay?
Okay.
So here we go. This is called pursuits, and this is at 0.1 hertz, and it's going to get faster. It's going to go 0.2 hertz and then 0.4 hertz. And this will tell us, and what we're looking for is for any jump off the target at this point. Here we go. You just keep following the target the whole way. And this will measure as the wave goes up, this is to the right, and then as it comes down, this is to the left. And what we're looking for is for her eyes, like right there, just jumped off the target, and right there. Keep going, keep going. Just doing roll, and a little bit of jump right there. So this gives us kind of an insight into how well her brain is really functioning. Now what we're doing here is we're actually checking the integrity of her midbrain, okay? Because certain things in the midbrain control her tracking to the left and to the right in a horizontal plane. So if there's discrepancies or there's problems in here, then what we do is we isolate our treatment to that area of the brain or whatever's close to that area of the brain to try and control the whole, whatever controls that whole area.
So what this is doing is focusing on what portion of the brain needs to be worked on to solve the problem.
Exactly right, yeah. And we can tell this by the movement of her eyes. So now we're going to go up and down. Now this is checking the top part of the brain stem, okay? And so if there's any jumps off the target going up and down, this will tell us what part of the brain stem to work in to kind of correct this. So if there's any, so essentially what we're doing is we're bringing the integrity of the brain stem up, which will bring the integrity of the brain up, which will help a whole bunch of whatever issues the patient's coming in with. So like up in here, you can see there's a little jumping off the target in this area as she's going downwards. This is up and this is down.
Now the issues that she came in with were what?
she had Meniere's disease, which is ringing in the ears and dizziness and vertigo, and so we're going to try and isolate and see what we can do here. This is just one of the diagnostic tests. The full test is the neurologic evaluation is where we get the majority of our information from, but this is more diagnostic information to confirm what our physical exam, our physical neurologic exam has found.
And this will tell you. And what does the size of the pupil of the eye have to do with it?
The pupillary size tells us the integrity of her autonomic nervous system. So if the pupils are huge, that means her sympathetic nervous system is firing constantly. If they're small and tight, then her parasympathetics are firing. So this tells us if she's got big giant pupils the whole time, that she has an overfiring sympathetic nervous system, which is, you never really want to do that. You always want to be in a relaxed state, and because high firing sympathetic nervous system means that you're constantly working, you're stressed out, you're producing a whole bunch of other hormones like cortisols, and you're beating yourself up. So what it really does is it gives us a window to how well the brain is functioning. What we want to do is we want to bring both sides of the brain up, so they're firing equally. Okay, so the frequency of firing of the brain is key, and the fuel. We got to get fuel and frequency of firing to the brain to get it to work optimally.
Okay, so then, you do the test with the patient. Mm-hmm. They come in to you with the problem.
Right.
You do the test. Mm-hmm. You evaluate it.
Right.
And then you have a consult with the.
And then what we'll do is we do certain strategies, certain eye movements, certain direction. It might be up, it might be down, it might be to the left, it might be to the right. We might wear colored glasses. We might have people listening to music in one ear to stimulate the opposite cortex. I might do vibration on one side of the body to stimulate the other side of the brain in the parietal lobe. We may do memory games. We use the Wii game, the Wii Fit game for balance and coordination. This is very powerful stuff, and what it does is it gets certain areas of the brain to fire higher. So you can get, so if the brain is working, let's say, make up a number, 50%. Okay, well, 50% of the brain right now is controlling 100% of the body. But if we can get the integrity of the brain to fire, say, 70 or 80%, and a little bit better, now we have 80% of the brain controlling 100% of the body. Okay, it has a much higher probability of helping the issues that the patients are coming with. We get patients with migraines. We'll get patients with dizziness and vertigo. We get a lot of patients with concussions. We've had Parkinson's patients come in, and so now I can't say that by doing these exercises we're gonna cure somebody with Parkinson's.
There's no miracles.
But what I can say is that the brain will function at a much higher level, which will give the body a higher probability of being helped. So when we raise the level of integrity of the brain, or of the way the brain is working better, it gives us a higher probability of helping the issues that the patients came in with.
Again, with no medication. Just a lot of work. And a lot of work on the patient's part, and electronics today have certainly helped us. And the Wii game.
And the Wii game.
And the Wii
Wii
game.
Wii game's a great game. Yeah, it's huge for balance.
Well, Marlene, thank you very much. Dr. George, thank you very much. And we're going on to the next person. Thank you. Thank you. We just caught this very gracious lady. Thank you very much for coming back in.
You're welcome.
Her daughter is here being treated for a concussion. But I understand she was dizzy for a number of months and nobody can do anything or figure out what it was.
Absolutely. She had been dizzy for about 4 months, and we couldn't figure out what was going on. We saw our pediatrician, who sent us to a specialist, who sent us for an MRI, and through all that, there was no diagnosis. We came to Dr. George. He did some tests with her, and he determined she had a concussion.
Wow. And she's what, 11, 12?
11 years old.
11
She's a
years
basketball player, and that's how she was injured,
fell?
playing basketball. No, she never fell and hit her head, so there was no indication that was going on.
See, that's something that we had discussed in a previous show, that people feel that you have to hit your head, but actually shaken baby syndrome, it's the rattling, the brain is actually hitting inside of the skull.
Actually, Dr. George said in a child that size, because she's about 67 pounds, all she had to do was be jarred from side to side, or even a whiplash motion could have caused the concussion.
And she's been here how many times now?
This is our 3rd week.
Okay, how's it going?
It's going wonderfully.
Is she still dizzy?
She's at a 0 today
Oh, really?
in terms of dizziness. So yes, I'm just amazed. This facility is fantastic. Dr. George has really nailed it right on the head and got the right treatments for us.
As long as she's not dizzy today, and tomorrow is going to be even better. I thank you so much for coming back
You're
in and
welcome.
talking to me.
You're
Thank you
welcome.
very much.
You're
Thank you.
welcome.
Now we're here with Linda, who is the massage therapist here at the Illinois Neuro and Physical Rehabilitation Facility. Linda, you work in conjunction with the doctors here at the rehabilitation facility with patients, but with I don't even understand why. Massage therapy would be a physical injury, injured knees, the most common that I hear about all the time, shoulders, because everybody is so computer oriented today. How do you work with the doctors in that?
Well, massage helps a lot of different things. One of the things that massage does is also help circulate the blood, and it also because it does that, and it helps relax your patients. It helps them clear their mind, have a better mental state, and relax more. So those things help a lot.
So it relaxes them to be more open to whatever treatment's necessary.
Correct. That could be one of the reasons, yes.
What's the most common injury or reason that they're coming to you with? What's the most common? Two of the most common.
Neck and shoulders and back.
And back, really?
Yes.
Lower back. That's what I hear everybody complaining about, is the lower back.
Yes.
What can we do to help ourselves to prevent lower back problems?
Well, for one, if you're lifting heavy things, be careful how you lift. Use your knees, bend before you pick up something. Stretching, exercise to help your core, to be stronger, to support your back. Also hydrating, drinking a lot of water.
That's
Those things
important.
help.
People don't realize how important
No,
just
they don't.
plain old water is.
Right. It makes a big difference.
Well, very good. Thank you very much, Linda.
Okay, thank you.
We're here now with Carl, who is the physical therapist here at the Illinois Neuro and Physical Rehabilitation Facility. Hi, Carl. Carl, you work also with the doctors in conjunction with what their recommendations are, et cetera.
I do. I work with all the chiropractors here and the physiatrist, whatever their recommendation, and they would refer patients to physical therapy, and then I would create a program for them.
So you create a program around a patient to their needs.
And then we talk about it and see if this program is geared toward the perfect program for the patient. Yeah.
And primarily you deal with people who come in with an injury of some sort, correct?
Yes, I do. We see a lot of people with back problems, either lower back and also the neck. Those are the primary things that we see. We also see those with shoulder like injuries, whether it's a frozen shoulder or like a...
What's a frozen shoulder?
Well, when your shoulder is somehow like stuck.
stiff,
It's
okay.
stuck. It's so painful. You can't move it, and it feels like it's frozen in that position only, and it hurts when you move it.
And you can help that, obviously.
Yes, in conjunction with a lot of other treatments.
Now, so it seems that the most common injury that you see are lower back.
Yes, it is. And right now I'm actually going to demonstrate one of the best exercise known to treat the lower back problem.
So you're going to send us home today with an exercise that we can
Yes.
actually help or prevent
Yes.
lower back problems?
Yes, I am.
Carl, you're okay. And thank you to our model today, or our demonstrator
This is
actually,
Dana.
is Dana. Well, thank you very much.
Oh, you're welcome.
Thank you. Okay, tell us what Dana is going to do and how we can do this at home.
All right, so this is called press-ups. technical term for it is extension and lying. Okay. What this exercise promotes is, of course, primarily extension of the back, which allows the back to be released with regard to the stiffness. Okay, so the patient is positioned face down on a mat or like a flat surface. Her legs, you're doing this on the bed, legs should be dangled at the edge. And you can put a bolster here for people with, like, say, tight hip flexors. That way the legs are relaxed while the upper body is working. Okay, so Dana's hands, her palms are directly under her shoulders. And from there, she's going to press all the way up to extension. Go ahead, Dana. All right, so elbows are locked. And then just go back down. Let's do that again. Maybe you can do 5. Oh. All right. Yes, but the best thing for this to be very effective, you can do like 10 every 2 hours or so. The goal is for you to do 100 in a day.
100 in a day?
Yes.
Dana, I don't know.
Not in this
There's
day.
5.
All right, that's very good. All right, now how about you stand up for me, Dana?
Now, Dana, let me ask Dana a question. Dana, was that fairly easy to do, or was it really hard to do?
No, it was easy. It was easy
really-
to do, yeah.
Okay, it's not like doing a push-up.
No,
Thank God.
no, not at all.
Yeah, and the best thing about it is that you don't need anything. You don't need any other equipment. It's something that you can do for yourself as well.
And you can do this on the floor or on a bed.
On the floor or in the bed. But sometimes, you're at work and there is no floor there where you can prop. So the best thing for you to do that is do the exercise in standing. All right.
In standing?
Yes, so
Okay, Dana, is Dana going to...
Yes, I'm going to have Dana do it. Just place your hands on your back and then...
Wait, turn around and let's see on the lower back. Let's see if she's doing
and
this
just
right.
Bend back, push, like that, and come back forward.
That feels good, actually.
It does.
Feels good on the lower back.
Okay.
Yeah.
All right. So at least this way they can maintain the extension of the back, because we spent a lot of time sitting all day.
And she should do this how many times to
10
feel good?
times?
10 times.
Yeah. Every hour or 2 hours. The most times you can do it, the better.
And Carl, what that does then, is that just releasing or relaxing the muscles in the back?
Well, if you want to be technical about it, it's moving your disc. Because when we sit too much, the disc migrates to the back of your spine. We want to get it back to the center.
And that helps you do that. And Dana, you said it really felt good.
It did feel good. Yeah.
Well, I don't know about anybody else, but I'm going to go back to the office and try that sometime, because that really, it looked like it felt good.
And it's an easy exercise. Everyone can do it.
I like the word easy. That's a good word. Dana,
all
thank you
about
very
easy.
much. Thank you. Carl, thank you very much.
Well, thank you for coming.
Okay, thank you. Sue, you were one of Dr. George's first patients.
Yes. I started with him when he was in a small home on Addison Road. It was Dr. Miller's practice, and he bought it, and I've been with him whenever I need him, on and off for all these many years. So he's helped me. Most recently, it was for sciatica and back problems. And so when I do need him, he's always available. I can always give him a call. I know he's here, and he's branching out, and he's growing, and I think that's wonderful. It's wonderful for the community. It's wonderful for him and his family and his staff. So I think that's great.
And it's wonderful for you.
Yes.
And
Yes.
thank you very much, Sue.
You're very welcome.
Thank you. Thank you all for joining us today here at the Illinois Neuro and Physical Rehabilitation Facility on Addison Road in Elizabeth. Dr. George, thank you very much.
Thank you for having us.
Kristen, thank you.
Thank you.
And Dr. Jerry, thank you very much. And thank you for joining us. Hope to see you here next time. I'm Lucille Zuccaro, and here's to your health.